Well, good evening. I'm Mark Gillette. In the next hour, we hope to give you a better understanding of the Affordable Care Act and its impact on you, your family, and where you work. We're joined tonight by a live audience at Millikan Auditorium on the campus of Northwestern Michigan College. In a few minutes, we're going to head back down there and take their questions. We're also going to take your questions via phone, email, and Twitter. And after this broadcast tonight, there will be a live question and answer chat on UpNorthLive.com. But first, let me introduce our first guest. Marti Lolli is the Director of Healthcare Reform at Priority Health and has spent the last few months holding community meetings and seminars on the changes that lie ahead for all of us. Marti, thanks so much for joining us tonight. We appreciate your knowledge and expertise. Tomorrow is a significant day, regardless of what happens in Washington tonight with the federal shutdown.
It is, regardless of what happens. So there's a lot of conversation going on about federal shutdown, budget crisis. The exchanges will be up and ready regardless. So the two are not intertwined.
So this goes into effect tomorrow. We are on the eve of something that we've been talking about for a very long time. Let's start with the basics. Why should we care?
Well, the Affordable Care Act and what's going on right now in America is one of the biggest changes we've ever had in the history of health care. And what it's about is getting 1.2 million uninsured in Michigan access to coverage.
Tonight we're going to talk about three different things. You're going to talk to us about three different things. And let's start with the first one. Why do I need coverage?
Well, you need coverage for three reasons, okay? First reason you need coverage is because it gives you access into the physician's office. So it's your ticket to care, all right? The second reason you need coverage is because you get 100% preventive care if you have plans today. What's preventive care? Preventive care is your immunizations, your well child exams, your physical exams. All of that is wrapped up into preventive. So you need to get your plan, you get your preventive care, and that keeps you healthy. The third reason you want to get coverage is because it gives you the peace of mind. We've all heard stories about the family or the friend who racked up $100,000 medical bills and is stuck paying that out of their personal pocket. So you need coverage for those three reasons.
And I guess there's probably a fourth reason as well. Is there a penalty if I don't have coverage?
There is. That's the fourth reason. So the Affordable Care Act introduces this new concept. It's called the individual mandate. Under the law, we're required as Americans to have coverage. If we choose to not have coverage, we will pay a penalty. Now, that penalty starts out in 2014 at $95 per person in the household, or 1% of the household income, whichever amount is greater. It goes up annually. So in 2015, it'll ratchet up a little bit, landing in 2016 at $695 per person in the family, or 2.5% of household income. Let's walk through a quick example. I think that'll help. Someone making $22,000 in 2014 would look at paying $220 penalty. That's if they didn't have coverage for the full 12 months of 2014. Now in 2016, that would go up to $695 for a household of one.
So it's kind of it's stepping us through that penalty process. It gets a little bit stiffer every year.
It does, as we get used to this.
As we get used to it. So how do I know what coverage fits me? The exchange is open tomorrow. How do I know what coverage is the best one for me?
Well, most of us access our coverage today through our employers. Our employer offers coverage. It's part of our benefit package, and that's about half of us in Michigan. The good news is we will not see significant changes there. So rest assured, if you get your coverage through your employer, most employers are going to continue to offer that coverage, and there may be some small tweaks at your open enrollment period. But we're used to that as employees. We see those changes every year. They'll kind of come out. Now, we could see some cost increases, though, this year also as employees because the Affordable Care Act introduces some new taxes and fees. The second coverage that we see a lot of is Medicare. So in Michigan today, about 17% are covered by Medicare. These are those that are 65 or older or disabled. The good news there, again, not a lot's changing to Medicare this year. A lot has been in motion related to the Affordable Care Act and Medicare, such as the closure of the donut hole and other things, but those are positives, and Medicare beneficiaries have been experiencing those already. The third place people get their coverage from is Medicaid. The current Medicaid program is staying intact, so there won't be any major changes to the current Medicaid program either, so folks on that plan can rest assured not a lot of changes in 2014.
Medicaid has made a lot of headlines here in Michigan lately with the expansion. What will the impact of that be on all of this?
So the new Medicaid program ushered in through the Affordable Care Act is an expansion of the current program. It's a new program entirely, and it will offer coverage to 500,000 Michigan residents who probably don't have coverage today. How does this work? Eligibility is strictly determined based on your household income. So how much revenue do you bring into your household every year? It's really designed to support those working, lower income Michigan residents and offer them a plan that's affordable.
So if we're not eligible for Medicaid, we actually have some examples here.
Yeah, so let's walk through a couple examples. A household of two, so this could be a young married couple starting out life. They're making $21,000 a year. This couple will be eligible for the expanded Medicaid program. Another example would be a household of four. So maybe this is a single mother, 3 children. She's making $32,000 a year. She will also have access to the expanded program. Now, that expanded program opens up in April of 2014, and we don't have a lot of details yet because the state still has to make a lot of decisions on plan design and cost sharing and how it's going to work. So stay tuned.
So more details to come on that. So if we're not eligible for Medicaid, what about the rest of us?
The rest of us. So those are those of us that don't have coverage through our employer, or we're uninsured, or we buy our own plan, right? The good news is the Affordable Care Act will give us some options. So we'll talk about how the coverage will work and what it might look like. First, it'll be offered to all comers, so no one can be denied access to coverage under the Affordable Care Act. Second, our premium will be rated a little bit differently. It'll only look at our age, where we live, and whether or not we smoke. So gone are the days of being rated based on your health status, such as diabetes or another condition. The other thing is, so third, all plans have to cover the same categories of benefits. So maternity, prescription drug coverage. Under the law, all services have to be covered by all plans. You can rest assured when you're shopping, you'll get a pretty robust package. And finally, it'll be easier to shop for coverage. Shopping for insurance is complicated,
it's confusing,
right? So under the Affordable Care Act, plans have to be categorized according to metal tiers. So, for example, you'll have your platinum plan. And that plan will offer the richest benefits. It will also cost a little bit more than, say, your gold or your silver plan. Your bronze plan at the other end of the spectrum will offer lower benefits, and it will cost a little bit less for those looking for a lower premium price.
But this should make it easier for us to compare plan to plan, program to program, right?
Yes, that's the intention. It'll be easier to shop for coverage.
All right, let's talk about some examples. Can people really afford this?
That's the big question, right? So, will folks be able to afford it? And really the ACA intends to make coverage affordable to each individual uniquely based on your household income. Again, household income being that driver. The easiest way to think of it is the federal government will discount the cost of your premium. So if you make less money, you could get a 70% discount on the actual cost. The federal government will pay a portion of that premium. If you make a little more money, the discount will be less. It may only be 30%. But let's walk through a couple of examples maybe to help.
That's always helpful,
So a household of one person making $22,000 for the year will pay about $120 a month for very decent coverage. A family working with four, making about $46,000 a year, coverage will cost that family $250 a month. So for $8 a day, that family will get free preventive care, will get peace of mind, and that ticket into the physician's office. So when you put it in that perspective, it's pretty reasonable for that family of four.
All right, very good. It's all starts. But a lot of people have been watching this for a long time. So the question is, where do I go? What do I do now? Now that this is required and now that this is going through, what do I do?
Tomorrow marks the opening of the exchanges.
Okay.
So the opening of healthcare.gov, which is a reference point. Folks can go to that website. They can enroll in a plan there. You can also come to priorityhealth.com. We'll help you enroll in a plan. There'll be lots of folks available to support you in this journey. Find a local agent here in your area. He or she can also walk you through this process. But here are the main dates. You got to remember the marketplace opens tomorrow, October 1st, 2013. But if you want your plan to be effective January 1st, you really need to make up your mind by December 15th of this year. Okay. Now, because it's the first year the exchanges are open, they're allowing individual consumers a little more time to make up their mind because they know it's complicated. Mm-hmm. Maybe not everyone knows they need to go buy their plan. So you have until the end of March in 2014 to choose your plan. If you fail to enroll in a plan, then you have to sit out the full year and wait until next year where you'll have a new open enrollment period annually.
All right. A lot of information. Marty, thank you so much. We appreciate that. When we come back, we're going to be joined by Jeff Zaleski from Blue Cross Blue Shield. He's going to talk about what employers need to know as we transition into the new world of healthcare reform. And in a few minutes, we're going to take questions from our live audience at Millikan Auditorium on the campus of Northwestern Michigan College. Stick around. We'll be right back.